The Parenting Research Centre was contracted by the Royal Commission to undertake a study looking at the implementation of recommendations from previous inquiries of interest to the Royal Commission. We looked at 288 recommendations from 67 previous inquiries. The key findings in the report were around the extent of implementation of recommendations. So we found that around 64% of recommendations were either fully or partially implemented, with 21% not implemented. And of that 21%, about 40% were under consideration or in the process of being implemented. And then 14%, we didn't have enough information to make a judgment or to be able to determine whether they were implemented or not. Were things like structural barriers, so where a jurisdiction couldn't actually have any influence over another jurisdiction, so that was a key barrier. Recommendations that were too narrow or not evidence-based. Conversely, recommendations that were too broad were barriers to implementation. Then there were things like structural and resource constraints, so practical things like not enough staff or budgetary constraints. The other key barrier was the organisational culture, so organisational resistance to change around some of the recommendations. Were things like having strong systems and processes to implement recommendations. So things like project teams, whole of government committees that actually had responsibility for implementing recommendations. Another key area was leadership. A key area was that leaders were involved from the very beginning and became champions of the change. And that connected strongly to having a vision for the change. So if an inquiry had a strong vision for change, what tended to happen was that leaders could be more engaged, and then you'd get more of a buy-in to champion that change. One of the key messages from the stakeholders was that we had early and ongoing involvement in the review process. People were particularly keen to have involvement in the process of developing and reviewing recommendations, so that when the recommendations came down, they were doable, the budget was available, and they were much more implementable. Well, the Royal Commission should be congratulated for commissioning this sort of research, because what it offers is an opportunity for us to learn from the past so that we're really improving outcomes for kids.